saying earlier, a lot of it's like improving. I don't know if y'all took theater or not. Okay, so first of all, you get the packet ready and you open it in a sterile fashion. And first you're going to have, there's going to be the first drape. And let me pull this up a little bit. So the first drape you can grab and you just kind of make your little field. Of course that part's not sterile. But then you grab the gloves, and they're going to be watching you put on the gloves in a sterile fashion. So we are able to do that.
Attention. Don't let it fall on my head, though.
Okay, so now they're supposed to stay down. And so now you can touch anything on this tray. Or just turn it another way. So now your gloves are sterile and this whole area is sterile. So just remember, you can touch anything on this tray. Because once you use this hand, I'm right-handed, so once you use the hand to hold the labia open, you can't come back. So I would first just get everything ready. You could probably just go ahead and put this over. And
We do all this for real, or we just kind of say it out?
no,
You do
you do it for real.
But a lot of it is still acting.
Mm-hmm. The only thing you don't use is the betadine. So you're doing this for real because they're watching every step, you're doing.
Somebody will be in the room just watching you. They're not going to talk to you or anything.
They can't. They're not supposed to coach you or anything. They're just staring and watching you. So first thing I would do is just set your top tray to the side, grab the Foley out, and then test that the little balloon. Okay, it works. A big mistake that I see students do is they take this off. Just leave it on there. It's going to be your friend. So that you'll just have ready. You can get the lubricant ready and squirt that on a little place on the tray. That one you can use. Just don't use all of it because sometimes they have to reuse these trays, and then your colleague will come up behind you, and then they won't have any left. But you'll be fine. And then we open the betadine and put it on the Q-tips or the cotton swabs. Yes. All right, so I'm pretty much ready to go. I got my betadine, cotton swabs, and my lubricant ready, and my Foley's ready with the little syringe attached. So I'm going to get exposure. Okay, so this is kind of anatomically correct. Everyone's different. I don't know if y'all have seen many Foleys, but sometimes it's so hard to find the meatus. But you can see it. It's the most anterior little hole there, the urethra. So with any sterile procedure, I was taught 3 times is a charm. So you always swipe 3 times. Okay, a lot of those betadine swab packs have 3 little swabs in them even. So you always start at the place you're going at and then around and then throw it away. Same thing, start at the base or the area you're going to and around. And then, if you're doing this, they're going to get it. You're going to get it. They know you know what you're doing. So another thing, I kind of hold it like this. So that way it won't be flopping everywhere and you might get it contaminated because you want the whole tube to be sterile. So now put some lube on it and then just insert it. That way you can push it through. And fill out. You probably do the whole thing. And then pull it through, and it'll stop. And that's it.
So we just keep pushing until we meet resistance?
Of course,
I know in real life you're supposed to get some.
Yeah, and I feel resistance.
Okay.
Because the ball is inflated,
Okay.
and
But you, okay, you inflated after, I mean.
yeah.
Do we have to, for the exam, do we have to pull on it to make sure there's resistance? Is that part of the exam?
Yes,
We do.
you should.
Are we supposed to give urine drainage too, or is that
No.
just an assumption?
Yeah, I don't think there's any liquid in these. So, as long as you can get it in there and get it stuck, you inflate it and it'll get resistance, and you show that. The thing is, this is 6 minutes too. So just try, like in your head, think about your systematic thing, like I was saying earlier. To try to, because once you use the other hand, you can't use this. So, little tips is keeping this on there. Once you test the little balloon, just keep it on there. And then once you pick it up, kind of loop it around so it won't be flopping everywhere and getting your Foley contaminated.
So when Dr. Karnovitz did it, he told us not to test the balloon.
Yeah, and there's some evidence that you don't have to. I don't think that's a checkoff point. And I can't remember if that's just routine. You're going to see every nurse does it, and in the operating room they always test it. But yes, there has been there was a study that showed there's no evidence of testing it versus not testing it. Because most, they're pretty good packaged and processed. So that's just for me, it's also good to know that it's on there, because sometimes you'll do this, it's not on there, and you're going to squirt the room. So, maybe it's good to know that it's actually stuck on there. So, that's up to y'all.
I will say this, they're going to look, it's going to be on their grading sheet, though. That
It
was
is
the sterile
to
field
test.
compromised.
Yeah.
They will grade you based on that if you compromise the sterile field. So you do need to know that.
And we don't have to talk through, can we just go ahead and just do it, or do we have to talk through the procedure? Like explain what we're doing and all that?
You can do that.
But do we have to?
I think the more information the person knows, the
they're
more
more
you're
like,
talking, the more they know you know what you're doing.
okay, gotcha.
I think it doesn't hurt
Gotcha.
to talk through
Right.
things.
If you can just do it without, because it would seem more like a real patient if you are talking, but you're not talking to necessarily talking to the patient. You're just saying, this is what I'm going to do. This is what I'm going to do. So it doesn't seem better. So.
Are we tested on how we clean up after, or do we just...
No, you leave it. It's a mess for them to pick up afterwards. I've done this station before, and it's crazy. Because we only have like a minute or two in between, and this is always the last station to get ready before the next group. So it's just,
I don't know if I missed this. Are we also going to have male dummies too?
it's possible you'll have a male.
It's just all,
It is going to
it's
be
just a
female. Okay.
The only one will be a female as far as the Foley.
Thank you.
And that's another thing about how far to go. If it was a male, the meatus, the urethra is longer, so you do have to go a lot farther.
I've never seen a male. We don't have a model for male.
And you'll see that a lot in the OR. We try to, the circulating nurses are really nice in showing you. You may want to just watch one first and really see how they do it, and then be comfortable and do it next time, or just jump in there and they'll kind of guide you. Any questions? Do you want me to do it again? Okay.
What about we have a volunteer?
Yeah, does anyone want to practice? I can set it up.
If you don't feel comfortable doing this and not ready for it on Monday, you need to come up there.
So I'll go ahead and put it back the way it's supposed to be, and y'all can just, that's up to you.
Can you get
It's going to be here. That's going to be it. That's what we're going to have.